We're joined now by Dr. Audrey Klenke from Pinnacle Plastic Surgery. We're so happy to have you here.
Thank you. I'm excited to be here.
So we have some exciting stuff that's coming up right now.
Always.
So here are some bottom lines when it comes to plastic surgery. One, every woman has thought about it. Number two, it's accessible.
Yep.
And number three, the relationship you have with your plastic surgeon is absolutely imperative. So if you've ever had some questions about having plastic surgery done in any way, shape, or form, surgical and non-surgical, the best thing you can do is partake in a seminar. And you have one coming up on March 12th. Tell us about that.
It's called Spring into Summer, Make a Daring Debut. So summer's coming up and people start to think about, okay, I'm gonna have to put that bathing suit on, I'm gonna be on the beach, I'm gonna see my friends, I wanna be outside, and they wanna look great and feel good. We'll talk about body contouring things, so things like tummy tuck and liposuction, things like arm surgery, breast surgery, and non-surgical options as well.
Okay, so when I walk into this seminar, what can I expect?
So it is going to be held in our office, and it is on Thursday, March 12th at 6 p.m. So you can come in and kind of get a feel for our office and meet our staff, and we can kind of chat. And then I'll be talking about specific procedures and options, and it gives people a chance to ask questions and kind of feel more comfortable about what's out there these days.
And there's so much. I mean, the options today are just absolutely limitless. Tell us about what some of those options are.
Sure, absolutely. So there are tried and true surgical things like tummy tucks and liposuction, but all of these surgical options really have evolved over time, and they continue to get better and better, safer and safer, and the recovery time becomes less and less. So we've learned a lot.
That's huge.
It's great. Yes.
The recovery time, downtime. What are some of the things that someone can do to be ready for summer and that's not going to have a lot of downtime?
Sure. So there are non-surgical options as well, and things that we can do in the office, like treating some of your leg veins. A lot of people are concerned about those things that stick out even when you're wearing capri pants, and they really don't like them. So we can do things in the office like sclerotherapy or laser, but also things like laser hair removal, where you know you're going to be out on the beach and you really don't want to have to shave every day. So why not just take care of it before summertime?
Tell us a little bit about the hair removal.
Sure.
You have a special coming up,
We do,
right?
yep. We have a special coming up for the month of March, and it starts March 17th and goes through the end of the month. So if you buy 2 laser sessions, you get your third one for half off. So it really gives you a kickstart there to get rid of some unwanted hair, whether it's face or legs or underarms, wherever. So that gives people a chance to really prepare ahead of time and not have to shave. It's great.
What actually happens in that procedure?
Sure. So you're actually using a laser that targets dark. And most people, for the laser to work well, you really want that dark colored hair. And it actually basically zaps the hair and the follicle at the root so that it doesn't come back. It does take a couple sessions because at any given time you've only got hairs in certain growth phases, so it has to take a couple usually to get rid of it.
Is it uncomfortable or painful?
We do everything we can to make you comfortable. I'd say the keys are the preparation ahead of time. So we try to be very specific about you want to shave the day of your procedure. Sometimes we use ice and actually numbing medicine, topical creams to try to make you comfortable. But I tell people, I don't mean this offensively, but if a man can tolerate it, anyone can tolerate it. and my husband's included in that, actually. So we try to make people pretty comfortable.
So I think this is really telling that there's prep beforehand, that you can be ready for things, and that you guys, it's not just about the procedure.
Right.
You guys are focused on what to do to prepare for it and then how it's going to be afterward.
Absolutely. And expectations. We want to give people realistic expectations for, I don't want them to feel like it's going to be one and done. And some people have lighter hair or blonde hair, and there are different procedures that we can do for things like that, like dermaplaning.
So dermaplaning.
Dermaplaning is a great option. It is performed actually by our brand new licensed esthetician, and she is wonderful. Her name is Liz Sakela. She's from Ohio, and she performs the procedure where you use a specific type of blade, and it actually removes dead skin cells and hair off of your face or really anywhere you do it. But people will come in once a month, and their skin will be really smooth and very soft and no hair. It's wonderful. Like that little peach fuzzy stuff, it's gone. It's awesome. It's great.
And is that a timely procedure, or is it?
Oh, it doesn't take long at all. It probably takes 15 to 20 minutes. No pain. It actually feels really good. It's sort of relaxing. You're in a nice little chair, and it's quiet. And when you're done, your skin just feels really good.
Tell us a little bit more about some of the other non-surgical.
Sure. So there are laser options in terms of not just hair removal, but also those veins in your legs that you don't like, and things like sclerotherapy, where I inject a saltwater solution and actually collapses the veins so they go away. And people love that.
So let's get back to your esthetician. This is a brand new thing for you all.
Yes, her name is Liz Sakela, and she is absolutely wonderful. The important thing is she is a licensed medical esthetician, so she's done all the proper training, and she does have some experience in the area, and we are just so excited to have her. She's from Ohio. Many people down here are from Ohio, myself included.
From Ohio.
So we have just had a great time, and she has a wonderful personality. She's very passionate about healthy living and also about skincare. So she can do all sorts of things like dermaplaning and our chemical peels and some laser. She does regular facials, hydrofacials. She can do all sorts of things. So it's wonderful to have her.
The key that you said there is medical esthetician. Can you sort of tell us how that's different?
Sure, absolutely. So there are lots of salons and spas out there that provide services like waxing and various massage things and eyelash extensions and things like that.
Right.
Whereas at our medical office, we're focused more on things that are more medically related and taking things kind of to the next level. So for people who those things aren't quite working anymore, we're there for that part, a more advanced skincare option, really.
Take it a little bit deeper.
Right.
Okay. And speaking of taking it a little deeper, let's talk about some of those surgical options.
Sure.
Because I know a lot of people have thought about liposuction, facelifts, and I think there are two major concerns that people might have. One is the downtime, and just sort of what takes place with all of this.
So I always start with a one-on-one consultation. I think that is really important to understand what it is that bothers you, so I can help give you the options that I know might get to your goals and help you reach your goals. Because what's right for one person isn't always right for another person.
Sure.
But these days there are so many options out there. Tummy tuck and liposuction are great options for the midsection and fitting into those bathing suits and some of those snugger clothes. Some people have lost a lot of weight throughout the winter and are ready to sort of get rid of that extra skin.
Sure.
And also breast procedures are very common coming up on summer. So some people either already have implants that are outdated or are interested in a breast augmentation, which is an implant surgery. Some people just need a lift and they just want the girls to be back up where they used to be. So there are all sorts of options out there these days that really the downtime has been drastically decreased from what it used to be.
Absolutely.
Right. So, and we have just a lot safer options and things that most of the time people are going home that day. So you're not staying overnight in a hospital. We have lots of medicines that help you feel comfortable after surgery, but a lot of it is sort of us meeting and saying, okay, what can I plan for? You know, if you have a wedding next week, here are my options.
Right.
If I have a wedding in 3 months, here are some other options. So it's really, it's a conversation.
So actually sitting down and having some questions answered and just taking time out to do that.
Right.
What's the best way to go about getting a consultation?
Best way is to call our office. We're at 815-6699, and we are in Sheridan Park in Bluffton. We sit right behind Bluffton Tire and Auto and Jim and Nick's and some of those yummy places. So you can call our office. You can actually go online as well. We're at pinnacleplasticsurgerymd.com, and you can schedule a consultation that way.
That's really the best thing you can do. If you have questions about it, if you're curious about it, if you've thought about having plastic surgery,
come on in.
You know, it's wonderful for us to be able to get to know you,
thank you.
To meet you in person, and because it's also a sort of a private matter for people.
It is. It's a very personal, and it can be hard to jump that threshold. So we try to help people feel as comfortable. But you know, it's such a common thing these days. It's really,
Absolutely.
And I think even the people here in Sun City are really amazingly in tune with health, and they want to know what they can do to stay healthy and be healthy. And plastic surgery is becoming a very natural, normal part of being healthy.
Absolutely.
It's like I've worked so hard to keep my health up on the inside, or I've lost weight, or I'm doing something really good for myself, and I want to sort of put the cherry on top, and they have every right to.
You hit the nail on the head with that. Being healthy, feeling healthy, looking healthy, to have your outsides match that, that inner health. You must see that an awful lot.
A lot of times patients will say, you know, I feel this age on the inside and I want to look the way I feel. I think that's very important. I think that's something we all kind of strive for.
How fulfilling is that for you?
Every day. Every day is different, and I love it. I love what I do.
Well, you know, folks could not be in better hands than with Dr. Audrey Clanky with Pinnacle Plastic Surgery.
Thank you.
And let's just talk one more time about that event that's coming up March 12th.
Yes, that is our seminar. It's going to be in our office. You have a chance to come in and meet with us. That is Thursday, March 12th at 6 p.m. and we're going to do champagne and some refreshments, and we break out the implants and have you you're allowed to walk around and look at things and ask questions, and we have our skincare products out. So it's a great way to just kind of get to know us and see what we do.
Absolutely.
Yeah.
Not to miss. Make sure you call in advance and set up your space, reserve your space.
Please do.
And we'll be right back.